Welcome, everyone. Good afternoon. We're so excited to welcome you to our age-friendly public health systems July training session on caregiving as a public health issue. I'm Megan Wolf, Senior Policy Development Manager at Trust for America's Health, or TIFA. And we're really pleased that you all have joined us today. For our logistics, Karan, if you could go to the next slide. And if you are using your computer or phone, please make sure that you're muted to minimize any background noise or echoing. That would help us. We will hopefully have some time for some questions and answers at the end of the session today. But if you do have questions while the session is going on, please go ahead and put them in the chat and we'll capture them and share them at the end with our presenters. We also want to let you know that our session today is being closed captioned. If you'd like to turn that feature off, you'll see a live transcript at the bottom of your screen, and you can click that button to turn that off. So next slide, please. So, due to the COVID-19 pandemic, we have all been made acutely aware of the need for all sectors to come together to support caregivers. And so we really appreciate the expertise of our speakers today who will help us understand the public health role in caregiving and give us some really practical examples of programs that can support caregivers. First, my colleague, Dr. Karan Phillips, will provide some background on how the aging services sector supports caregivers. Then our friend, Mike Whitkey at the National Alliance for Caregiving, who has been leading a collaborative effort to explore the public health role, will share his organization's perspective on the issue. Then we'll hear from Dr. David Bass and Kathy Kelly, who will provide some actionable information about evidence-based programs for caregivers of individuals living with dementia. So Karan, I will turn it over to you, and then you can kind of facilitate the rest of the way down. I will join you all back again to help facilitate the Q&A.
Thank you, Megan. So good afternoon. And we thought it would just be a great overview just to highlight the role of AAAs in supporting family caregivers. Family caregivers are obviously vital in supporting and helping older adults live at home and support their independence, their access to resources and services through the National Family Caregiver Support Program, which is under the Older Americans Act. AAAs provide caregivers with a long list of resources, including information about available services, assistance in gaining access, counseling support, support groups, caregiver education classes and training, respite care and services, emergency assistance, and some other supplemental services that can be ranging from different classes and resources. We also have a chart that highlights, again, some of the percentages of these services that typically are provided and how they break out by services in terms of the need. Some of the additional roles that AAAs provide, they connect family with local providers. So if you call, they're the ones that can connect caregivers to different resources that are additional to the basic needs. They can also help provide caregiving plans, and help triage and address specific challenges that the caregiver may be experiencing and need to address regarding their loved one. And they can identify additional supportive services. They offer a wide range of evidence-based programming that are targeted towards supporting caregivers. For example, of one that is used by 39% of the AAAs. And that statistic is from the National Association of Area Agencies on Aging recent caregiving survey. Survey that they give to their AAAs, and that information comes from there. So 39% of area agencies on aging offer this evidence-based program, Powerful Tools of Caregiving. So again, we wanted to make sure that we acknowledge and share the rich resource base that the area agencies on aging provide to caregivers. And without further delay, I will turn it over to Mike Whitkey for our first part of the training today.
Thanks, Karan, and hi everybody. Thank you to Trust for America's Health for inviting myself and my colleagues to come and speak to you today about this important topic. Looking forward to sharing just a brief glimpse into some of the aspects that we've been looking into regarding the landscape of caregiving through this public health perspective. And we truly do feel that caregiving is a public health priority that is made even more obvious and has been spotlighted greatly through the recent issues that families have been dealing with through the pandemic. So my name is Mike Whitkey. I'm the Vice President for Research and Advocacy at the National Alliance for Caregiving. So you can go to the next slide. Today's discussion, just a quick overview, give you a little bit of information about the National Alliance for Caregiving and the work that we do. We'll go into just, like I said, a brief glimpse into the current landscape of caregiving and public health, review some of the lessons learned that we've experienced through this COVID pandemic, and explore some potential opportunities for next steps. You can go to the next slide. Okay, so just a quick overview of the mission and the vision of the National Alliance for Caregiving, where we have a vision of a society that values, supports, and empowers family caregivers to thrive at home, work, and life. And the way that we do this work is we build partnerships in research, advocacy, and innovation to make life better for family caregivers. One of our specific strategic objectives through our advocacy work especially is to advance caregiving as a public health issue and build awareness that changes the national conversation to empower caregivers. We've established this objective recognizing that whereas caregiver morbidity is a primary public health concern, caregiver mortality is also an issue. You can go to the next slide. So to further solidify who it is that we're working for here, and I'm sharing this picture and this quote from Terry Lynn. People like Terry Lynn remind us of our mission, why we're doing what we're doing, who we're working for, and this quote underneath her picture describes the sentiment that we hear over and over from caregivers. She said in a recent interview that we did with her that caregivers run and run, they never know where the finish line is, and she feels the hardest part of being a caregiver is learning how to be a caregiver. And so I wanted to just put this out there to really kind of help bring a face to this population and why organizations like ours and that of my colleagues here on the presentation do what we do every day. Go to the next slide. Okay, just so to start by laying out this landscape, let's start with the definition, who it is that we're talking about when we refer to caregivers. The term that we typically refer to has been codified in law through the recently passed Raised Family Caregivers Act, which defines the caregiver by saying the term family caregiver means an adult, family member, or other individual who has a significant relationship with and who provides a broad range of assistance to an individual with a chronic or other health condition, disability, or functional limitation. The caregivers must be considered in the context of lifespan needs that vary according to the ages, developmental needs, mental health needs, and physical health demands that are placed on both caregivers and care recipients. You can go to the next slide. Okay, so all of our policy work and really the foundation of what we do is driven by research and data, and provide a foundation for why we view caregiving as a public health issue. This perspective starts with the goal of public health in the United States, which is to promote healthy individuals living in healthy communities, pursuing quality of life rather than simply absence of disease. So just a few stats to show you today to help frame this conversation, why caregiving is a public health issue. You can see on the screen here, and I'll just go over them briefly. This flyer can be found on our website, along with a larger report that we do in partnership with AARP called Caregiving in the US, that is a national survey that we do every 5 years that helps us understand how many caregivers there are and the types of issues they're facing. So we've known that the last time we did this report in 2015, and we just prior to this most recent version that we put out in 2020, we know that the population of caregivers has increased from about 43.5 million in 2015 to 53 million in 2020. So it's about 1 in 5 or 20% of the whole population of people that are serving as caregivers, which is you can see here as an increase from 18% in 2015. And we know that since 2015, the increasing numbers of families are finding it difficult to coordinate care, that they're reporting their own health as being poor or fair as rated by their assessment. That about 23% of Americans say caregiving has made their health worse. So one of the things that really stands out to us here is that about 45% of caregivers report 2 or more condition categories compared to 37% in 2015. And we also know that in addition to caregivers wanting information about keeping the person they're caring for safe at home and managing their own stress, just about 13% of caregivers say a healthcare provider has asked what they need to care for themselves. So this is just a small glimpse of some of the statistics that really kind of highlight this need. And there's much more that you can find by looking at caregiving in the US and some other data that's out there. And I'll share some more resources here in the next slide if you want to move on. Okay, so the concept of caregiving as a public health issue is taking hold, but at an early phase. The way we define caregiving as a public health issue is continuing to take shape, and how we take action is currently being defined. So now is a great time to have this conversation as the landscape is evolving. The CDC has been forward thinking about this topic and has producing materials that provide a good foundation. You can see here on this screen is one publication that the CDC put out in partnership with the National Association of Chronic Disease Directors, focusing on caregiving as a public health issue. And so there's a little bit more, there's some more literature there that is available as a resource to everybody who's interested in learning more here. One of the things that has been gathered through some of the data that the CDC has collected is that over half, or 53% of caregivers, indicated that a decline in their health compromises their ability to provide care, and that about 40.7% of caregivers report having 2 or more chronic diseases. So the way that to think about caregivers, not only do caregivers serve as a critical part of the care ecosystem for care recipients, but caregivers are also an at-risk population and face their own ill health effects. You can go to the next slide. Okay, so this illustration helps frame why addressing the needs of caregivers will potentially improve overall population health and strengthens institutions in our society that are person and family centered. So within the US healthcare system, a shortage of nurses and other healthcare workers has been accompanied by increasing costs associated with hospitalization and long-term care, leading to patients with involved care needs being discharged from hospitals more rapidly than in the past. And in addition, recent medical advances are saving the lives of thousands of infants who will require lifelong care for disabilities or chronic illnesses. So one of the ways that oftentimes the stresses and strains that caregiving places on families can create what we kind of typically refer to as a burden within that family, or within that relationship between the care recipient and the caregiver. But one of the ways that we can reframe this, by especially viewing this more as a public health issue and addressing this as a larger societal issue, is that caregiver supports can reframe the concept of caregiving from a you versus me in this caregiver care recipient relationship to a us versus the disease. How can we work together to address the stress that's being placed on us and that has put us in this position that people are typically not very prepared for? They are finding themselves in this position without a lot of expectation. This is something that's going to happen to them one day. So you can go to the next slide. Here are a few examples of current initiatives within the public health landscape that are inclusive of caregiver interests and can be used as a model for replication with other chronic disease populations, and to better understand how public health professionals can evolve the way they think about this critical population. The one thing to keep in mind, if you're not already aware, is the behavioral risk factor surveillance system, which are often referred to as the BRFIS survey, that is administered through public health departments in states, offers a optional caregiver module, which collects some data on the population of caregivers. It's a very small set of questions, but it helps sort of enhance the way that public health professionals are able to collect and assess the population of caregivers on the state level. It's, as I said, it's an optional module, so it's not always undertaken by every state, but since 2015, a pretty good, a vast majority portion of the states have administered this module, and has been a very critical tool for researchers in the field to understand caregiving as a public health issue. And also, particularly within the Alzheimer's and dementia channel of support, there have been really some strong initiatives that can be viewed, and not only in terms of how to address the needs of people with Alzheimer's and dementia, but can be also potentially replicated and adapted to be able to look at other condition states as well. So one thing that has really been a strong tool here is work that's been done through the Healthy Brain Initiative, which has put caregiving as a central component of this work that has been done through that initiative. And most recently, as of the passage of the BOLD Act, or Build Our Largest Dementia and Alzheimer's Infrastructure Act, within the CDC has been established a Public Health Center on Excellence for Dementia Caregiving, which is designed to create technical assistance opportunities and materials and resources for public health departments, and specifically BOLD Act recipients, to be able to utilize when they're addressing and recognizing how to interact and interface with the population of caregivers. So just a couple of initiatives and things that have been implemented recently to be able to take a look at more deeply on this subject. You can move to the next slide. Okay, so the topic of caregiving has been given a larger platform via the Biden administration, as they have included in some of their core in some of the president's core legislative proposals and his signature policy proposals, the issues and the needs of families who are thrown into this caregiver role has been a really central part of some of the work they've been doing. So the American Jobs Plan, with the proposal to really invest in the care economy, as some have described, the whole purpose of that was recognizing that needs that families that have been placed on families who are navigating care responsibilities. A lot of the language in the American Jobs Plan is focused at professional or direct care workers. But the way that they have framed the need for this type of legislation is to reduce that burden that's been placed on families through this caregiving challenges that people have been dealing with. Also within the American Families Plan, there's another core component of that has been addressed at recognizing and trying to alleviate some of the challenges that American families are seeing. One of the main proposals there is the proposal to create a national paid leave program that allows caregivers to be able to stay in the workplace and also take the time off paid when they need to be able to be there for their families. Some of the recent appropriations language that has come out lately through work that's been done on the Hill has really taken the lead from some of these signature proposals to show where the budget can help be increased to address some of the needs of these families. You can go to the next slide. Okay, so now is the time to seize on the momentum that is occurring and lessons learned from the COVID public health crisis, which greatly impacted caregivers since they were often the front lines of defense for those who are most vulnerable to the virus, and where were also forced to be separated from those who they were caring for. So this is really a timely and relevant issue for the nation to be able to bring caregiving out of the margins and into the mainstream. Some of the ways that we think that we can be better addressing the needs of caregivers through this public health perspective is formally recognizing them as key contributors, integrating them into formal systems of care, and providing support to them that addresses their risk factors. I'll go on a little bit more on the next slide here. Okay, so this is an illustration that that describes some of the ways we see the pandemic has as affecting the lives of caregivers. Oftentimes, there are caregivers who find themselves who are unprepared for care, those who felt like they were undervalued as care partners, and those who felt like there was an undue amount of pressure on home, self, and family. So I'll just let you take a look at some of these word clouds here that show some of the description of caregivers that they felt were most significant to them as they were going through the pandemic. Things like difficulty finding trustworthy information, support for self-care, managing medical complexity, things like lack of support during care transitions, and feeling like they are able to address needs related to safety and security. So, a lot of different issues that have really been spotlighted and highlighted through the course of the pandemic over the last year, and really aren't expected to go away once the vaccines have been rolled out. This is still something that families are going to be experiencing during their journey of care. And go to the next slide. Okay, so just another illustration that describes some of the examples of things that we can do to be better prepared in the future for other public health disasters that might come our way. And we tried to categorize these based on preparing caregivers for caring, including caregivers in the care team, and connecting caregivers with supports and services. These are not new topics. This is especially as we have worked in the field of care, those who have worked in the field of caregiving, none of these subjects are new or novel ideas, but I think that some of these ideas, as it relates to the context of public health, it's a place to start. There is no need to start from square one when we're thinking about how to provide or develop interventions for caregivers. There's a lot of work that's been developed out there, and they're very applicable to public health. It's just that public health can play an additional or complementary role to some of the previous intervention strategies that have been created throughout really the last few decades. And I'm sure we'll be hearing more about this later in the presentation today. You can go to the next slide. Okay, so here's an example of just one environmental scan that was completed as a result of the pandemic and is focused on this population. There are many more that are out there, but this really, what the reason why I put this up here is to highlight that it's the pandemic has created a moment of awakening for the society as a whole to recognize that the needs, the physical and mental well-being of particularly older adults and their caregivers is really going to be critical to address during public health emergencies. And so this is a large scan that went through and looked at not only the needs of older adults, like I say, but also caregivers. And some of the findings that they produced in the end here highlight some of these examples that I've been talking about earlier around interventions that they found in this report, which sort of reiterates and reinforces the point I made in the last slide. There are 4 major needs that caregivers had during the COVID-19 public health emergency, such as needs around caregivers' own physical and mental health, needs around the care recipient's physical and mental health, financial concerns, and the need for respite care to give them temporary relief. And also, one of the things that I thought was really critical that came out in this scan that we see time and time again is that there are gaps in strategies and interventions that persisted for key subpopulations within the selected group of caregivers of those with chronic conditions, as there were few interventions targeted at specific subgroups such as racial and ethnic minorities and individuals with disabilities. Go to the next slide. Okay, so I'd like to just close this part of just kind of opening up a broader foundation for this landscape by reiterating that public health can view caregiver needs not only as a means to better address the needs of people with serious health conditions, but that caregivers themselves are a population with their own set of unique challenges. And oftentimes as this illustration suggests, these needs overlap. So oftentimes caregiver interventions are more focused on care recipient needs. Sometimes they could be more focused on caregiver needs, and then there are a set of shared needs. Oftentimes things like sharing information about specific diseases, emotional support, workplace and financial support, are really some of the main issues that we see as being overlapping. Oftentimes when we're thinking about the care recipient needs, some of the things that really stand out are information about self-care, access to treatment, access to clinicians, improved health, and autonomy and shared decision making. And then when we think about caregiver needs, regardless of the needs of the care recipient, oftentimes caregivers are in need of information about how to provide care, how to provide skilled and non-medical respite, or access to skilled and non-medical respite care, and support and training for medical tasks, and what we refer to as activities of daily living, or ADLs, or instrumental activities of daily living, IADLs, and also making sure that they are included in that healthcare team. So again, just kind of a little bit of repeat here, but just to kind of drive the point home, about some of the previously established potential interventions and ways to provide these supports and services, where oftentimes you're going to need the way to be able to interact and interface with caregivers would need to be done through organizations like that are centered in the community. But public health has a really strong opportunity to help establish a stronger sense of messaging, to really describe the needs of caregivers, to be able to talk about how supporting caregivers is important and why it's important, but also public health really has a strong role in understanding how the population of caregivers looks, what types of interventions are helpful in reducing costs and improving health outcomes, making sure that the way that we're serving caregivers is designed in a way that really is the way that they want to, that meets their goals and their needs. Okay, go to the next slide. So thank you for taking some time to listen today. Open to any further questions, or you have the contact information for myself and our Director of Advocacy and Engagement, Karen Marshall. If you have any further questions, if you would like further information or resources, this is something that is really central to the work that we're doing at the National Alliance for Caregiving, will be for the ongoing future. So please, our door is open to you if we can do anything to help have a little bit more in-depth discussion around this topic. Thank you again.
Thanks, Mike, so much. Really appreciate all that you and your team are doing, and your network as well. Really appreciate all the conversations about caregiving as a public health issue. So thank you so much for being with us today. We'll see if we have some questions at the end.
Thank you.
So Dr. Bass, we will turn to you and Kelly.
Thank you, Megan. So I'm going to take off on the topic of interventions for caregivers that Mike did a great job at introducing. And really, it's been for 30 years, research and pragmatic trials have looked at different kinds of programs and services for caregivers, particularly caregivers of people living with dementia, as well as other caregivers assisting someone with other chronic conditions. And over that 30 years, we've got a lot of really top programs now available. And that's what we're going to talk about today with a website called Best Practice Caregiving. And it's a resource that's out there, free and available to you. So next slide, please. I'm here representing a large project team. We have 4 major organizations that are participating in this. Kathy Kelly will follow my presentation and pick up some additional topics that I won't touch on. I'm from the Benjamin Rose Institute on Aging. Kathy is from Family Caregiver Alliance. Katie Maslow from the Gerontological Society of America, and Mike Simmons from Bridge Builder Strategies. And a team, we each have teams. So this is a major effort that involves lots of people who Kathy and I will represent today. We have great support from our amazing funders, the John A. Hartford Foundation, RF Foundation for Aging, and Archstone Foundation have been instrumental in not only financially supporting this project, but helping to guide it and advise it. So we're greatly appreciative of them. Next slide, please. So the good news around caregiving is that during this last 30 years, we now have many proven non-pharmacological programs that have been shown to benefit family and friend caregivers. And that's really good news. It's nice to be able to come and talk about advances in the field and not really just identifying problems. And that's what Kathy and I are here to talk about. And that's what best practice caregiving provides to anyone who accesses the website. Some of these programs not only benefit caregivers, but also persons living with dementia. And many of these programs, even though in order to be in best practice caregiving, there had to be a dementia focus, because dementia caregivers, we know from research, experience more serious negative effects of caregiving compared to other caregivers. And the cost of care because of dementia is higher than the cost of care for other chronic conditions. So we decided to start with dementia. But many of these programs are relevant for people with other chronic conditions as well. So good news, we have lots of programs, they're available, they have proven benefits. Next slide. The problem is that at the current time, these programs have limited availability to family and friend caregivers and persons living with dementia. Few of these programs can be found in most communities. Most healthcare and community organizations, including public health departments that could be offering these programs, are not offering any of them. And most family and friend caregivers, as a result, can't access these programs. So that's the problem. Next slide. There are multiple reasons why these programs are not widely available at the current time, but we're tackling one of those problems, which is a significant problem among the multiple reasons that account for this. And that there's a limited knowledge base about programs that are available and ready to be scaled to communities. Before we implemented best practice caregiving, one of the problems of finding information was there was no comprehensive, updated, single source to go to find information about these programs. If you were a professional, you were an organization wanting to start a caregiver program, how do you find them? Where do you begin to see all the options? How do you decide what would be a good match for your organization? You could go to the research literature. Published research literature is out there. Unfortunately, lots of people, especially in service organizations, don't have wide access to the research literature. Even if you find those research articles, they often don't have exactly the kind of information that you want if you're an organization considering starting a new program. You're probably going to find in those research articles a lot of information about the outcomes achieved in a serious research study. But you're going to have a hard time finding detailed, comprehensive information about other characteristics of those programs. What kind of staff deliver the programs? How many sessions does it have? Is it widely available? Can you get training for your staff to do these programs? How much does it cost to implement one of these programs? Are there eligibility criteria that caregivers need to meet? These very specific implementation characteristics often are not in those research articles, and if they are, they typically are not described in a comprehensive way. You also have a hard time finding other organizations that are doing these programs and how their experiences have gone. Has it been easy to find funding, to enroll caregivers? Do caregivers like it when they use it? It's tough to find that kind of information in the published research literature. So it's really hard to know what programs are working well in other communities, in organizations like yours, if you're one that's looking to start a program. Next slide. So with all that in mind, our goal was to start a place, a single site where professionals can go to find comprehensive information about the top programs in caregiving that focus on dementia. So in 2020, in January, we launched Best Practice Caregiving. And it's an easy to use, free online tool for professionals. Right now, Best Practice Caregiving has 44 of the top programs in there. And I'm going to talk in a minute about the eligibility criteria for inclusion. If you go to Best Practice Caregiving, you can find comprehensive program profiles. Every one of those 44 programs, there's a wealth of information about not only the research findings that establish the evidence base, but the implementation characteristics of those programs. The manuals, the training, the types of staff, the number of sessions, all that kind of information is available. The experiences of non-research delivery organizations that have done these programs is in there. So we get a lot of questions about from organizations that say, well, we found this program in these controlled research studies, positive outcomes were achieved, but is it really feasible for us to take that research tested program and put it in our organization? Will that work? Can we integrate it in with everything else we're doing? So in Best Practice Caregiving, you can see results from organizations that are doing these programs outside of the context of a research study. As I mentioned, you'll find the basics about the research. You'll find the kinds of studies that were done, the samples that were used, the outcomes that were found to benefit for caregivers and persons living with dementia. You can find complete bibliographies. So we tried to create a link to all the published articles that established a program's evidence base. And importantly, it sounds simple, but you'll get the name and contact information for the person or company who now distributes that program, so that you could talk to somebody directly about how your organization might start that program and what you need to consider. Next slide. The eligibility for programs in Best Practice Caregiving, there are three, and this is a really important topic, because there are lots of good programs that are not in Best Practice Caregiving because they don't meet our eligibility. But we really came at this believing that one thing we wanted to include were programs that have a strong research evidence that they actually lead to the positive outcomes for caregivers. So the first criterion we focused on was that there had to be at least one US-based randomized controlled trial, non-randomized trial, or a pre-post study without a control group. It had at least 50% of caregivers who were assisting a person living with dementia. It had to be caregivers who were assisting someone living in the community. So we did not focus on people living in residential facilities. And that's a limitation of Best Practice Caregiving as it currently stands. And there had to be a statistically significant published beneficial caregiver outcome. So not only did it have to be found in the research study, but it had to be published and to go through the review process in getting something published. So that's our research criterion. There also had to be at least one non-research implementation of this program offered as a regular service in a community or healthcare organization. So this is how we tried to get at the feasibility of these research tested programs being implemented in a community. And finally, the program had to be available to replicate. There are a lot of programs that have been developed, tested, implemented at one time or another, but nobody's distributing them anymore. There's no one to call. There's no availability of training manuals now. So it had to be a program that you could get if you were an organization. Next slide. Just to lay out our guiding principles, we did use a pretty inclusive definition of evidence base. So we included programs that were based on studies using a pre-post-test study design that didn't have a randomized control group. So there are about a dozen or so programs in our best practice caregiving that were based on pre-post studies evidence without a control group. The rest did have a randomized or non-randomized trial, but we allowed programs in because there are some really good ones that may not have gone through the top line kind of research for really establishing evidence, but still had good solid research support. We decided not to do subjective ratings on the quality of programs. So we don't rate programs for how good they are. We tried to provide as much information as someone would need to make their own judgments and know where to turn to find out more about program quality. So if a program made our cut, we didn't rate it per se, but you can find everything you need to make your own decision about whether this program is right for you and your organization. We emphasized implementation characteristics with the basics about the research. And as I said, we try to give everything that you would need to take the next step of contacting someone who really distributes the program, because there's always going to be some details about starting a program that you can't fully represent in a website or in written material. And we're learning a lot about the gaps in programs. So even though we've got 44 programs, there are a lot of gaps in programs that aren't out there that are needed. And that's important information that's coming out of our best practice caregiving. Next slide, please. Just in the interest of time, here's a little bit about how we found our programs. We looked everywhere and solicited help from lots of knowledgeable people to spot programs that might be eligible. We still don't have them all. In fact, right now, in the next few months, we're going to be adding about a half a dozen more programs that have either become eligible since we started best practice caregiving, or were eligible right along, but we didn't know about them. So if you know of a program or you're doing a program that you think meets our eligibility criteria, we'd love it if you would let us know about this program, and we'll take it from there, because we'd love to have more programs and all the programs that meet the criteria included. Next slide. Here's a list of the 44 programs that are in best practice caregiving now. At this point, if we had a longer presentation, Kathy and I would go into a demo of best practice caregiving. You can easily do that for yourself. And on the last slide in the deck, you'll get a link to best practice caregiving, as well as the email addresses for all the members of the project team. And we'd all be happy to help. If you need help or have questions on how to use best practice caregiving or suggestions on how to make it better, we'd love to hear from you. Please don't ever hesitate to reach out. So with that, I'm going to go to the next slide and pass it to my colleague, Kathy Kelly from Family Caregiver Alliance, who will talk a little bit more about its use.
Thank you, David. And I'm going to talk a little bit about the organizational decision-making and how people select programs. In the context of looking and selecting these programs, our work at Family Caregiver Alliance, we've worked directly with family caregivers and services and research and system development of the Caregiver Resource Center across the state of California. And we've had a considerable amount of effort go into looking at best practice programs, whether they're in this particular database or not, of implementing programs across the state for our very diverse population. And suffice to say that these are all the kinds of questions that we would ask ourselves if we were considering programs for family caregivers. They're not all the same. What's nice about best practice caregiving is it does have a lot of detailed program comparisons that are really important. I think for the public health sector, there's been some activity, and I just want to mention this at the end about what, some of the activity has been going on in the state of California through the California Department of Public Health. So I'll leave that to the end. But there has been a fair amount of activity and development not just in operating these programs, but also other kinds of community initiatives around, excuse me, supporting family caregivers. One of the basic issues I would say is you first have to really evaluate what is going on in the community, the assets and services. Even if you end up using one of these programs in best practice caregiving through a public health information or education effort or caregiver support effort, there's always going to be questions. One particular intervention doesn't fit all of the needs of one individual caregiver. It's rather sort of a package of services. So understanding where else in the community those pieces of services in part or in whole can you refer the family caregiver to. So it's really important to know what those community assets and services are. Are they offering the same type of information or education, or is there a different kind of population segmentation that you can do within your own public health system? All of the staffing requirements, and do you have the right discipline for that particular a module that you're going to undertake? All of those things are just normal, what I would consider matching in terms of thinking about program development and program offerings that go on within any organization, within any community. One thing that's been interesting to watch in the, particularly because of COVID, obviously, is that the mode of delivery has significantly shifted to where when we started best practice caregiving, there were a few that offered online or either through telephone or through internet platforms. And this has actually been transformed, I think, because of COVID, but also because of the changing demographics of the population of caregivers and the way in which they choose to seek information. So there's a lot more online offerings if you were at all interested in that. So all of these things, the cost, sources of reimbursement, compatibility with mission, all of these things are what I would call general considerations when you're trying to plot a course in program development. Next slide. Just to talk, sort of to close it up about what we have been doing in terms of marketing. The best practice caregiving as it's conceptualized now really was for a professional audience like yourselves or others that operate organizations. And so in the world of the internet and thinking about who your demographics are and target population, we've actually acquired 30,000 users in the first 14 months, which is actually pretty extraordinary given the all of the noise that's on the internet to really focus and target our marketing. We are reaching the professional organizations such as yourselves and others to make them aware of best practice caregiving and to think about the programs that are in there and be able to do their own comparisons. We've done a lot of presentations and program informatics, and if you go on the best practice caregiving site, you'll get a lot of this other background information about the program as well. We are currently in discussion about developing a consumer version to link families with where these programs are located across the country. What we found, and it's not surprising because best practice caregiving is on the FCA website, and we primarily have been an information disseminator since 1996 when we put up our first website for information for families, that we get a lot of consumers coming into best practice caregiving to look at these programs. And so I think, it's a natural next step and outgrowth to be able to connect folks, caregivers that are looking for services to programs that would be in their state or nationally offered through online, but to give them a pathway to finding the kinds of services in their community that they're looking for. We're also expanding the focus on diversity. We have a collaboration with Diverse Elders Coalition to kind of, come full circle and think about these programs in the diverse communities that are across the country. And then we're thinking about the broadening the eligible programs that could be in best practice caregiving. I did want to mention that the state of California, through the California Department of Public Health, for way over a decade now, I'm not quite exactly sure when it started, but it's been over a decade, has had an Alzheimer's disease program that has a number of components under it. There's centers of excellence at medical academic centers, and awards to scientists to study Alzheimer's, but also the issue of caregiving. But I wanted to mention them in particular because there's 6 county departments of public health that are currently undertaking activities that are consistent with the Healthy Brain Initiative and local public health partnerships to address dementia. And I thought I would mention this to you as perhaps a follow-up companion education piece, because the work has been a 3-year arc and they're in year 3 of this 3-year arc. And it's a really exciting effort because while there's been some work in public health, it hasn't been ubiquitous across all departments of public health at the local level. And this is starting to advance that direction, albeit in dementia caregiving, starting to direct their attention in this area. And it's also very exciting. The other piece that was laid out so nicely by Mike was around the BRIFIS information that is collected across states, but it's pretty spotty on caregiving issues. I also would like to add that there's CHIS, which is the California Health Information Survey, that has a fairly robust, beyond what's in BRIFIS, component about family caregiving. The sample size on these samples are anywhere from 10 to 20,000. So it's individuals in the state. So it's pretty, it's a population size sample. And I just wanted to say that this component, which is housed under UCLA in health and policy, is what I would call an expansive look at from a public health, from a population size sample, family caregiving, albeit in the state of California. I understand, that we're, not the world, definitely, but I just wanted to point it out and to say that these are all models that could be implemented in the state, both the BRIFIS and the CHIS in some way, shape, or form. So with that, I'll stop the presentation so we can take some questions. Thank you.
Great. Thanks, Kathy, so much. David and Mike as well. Really, really interesting, valuable information. So I just wanted to, I haven't seen any questions come in the chat. So before I offer my questions, I just wanted to see if the presenters had any questions for each other. And Karan, why don't you go back to the slide before, just so that we can have that contact information up there for those folks. But Kathy, David, or Mike, I don't know if you had questions for each other. I wanted to give you that opportunity.
I do not.
Okay. Okay. So, well, I have a few questions that I've been written down, so I will, I'll take advantage of the time until other questions may come up. But David, you talked about, when you were talking about eligibility for the programs that would be included on the site, you talked about caregiver outcomes. And I wonder if you would expand on that a little bit. What are you looking for in terms of caregiver outcome, and why not care recipient outcomes?
Well, in the information for each program, you can go on and find all the outcomes that were tested in the research studies on a program for both the caregiver and the person living with dementia or the care receiver. So if you want to know how did these programs impact people in a positive way from a research point of view, you can see whether it's levels of depression, care-related strain, feelings of embarrassment about an illness, reduced hospitalization, emergency department use, all that information is there. Eligibility, my reference was mostly around organizations that currently offer these programs and whether they restrict access to them for some reason or another, perhaps for people living in a rural area. So some organizations might offer a program, but only if you lived in a rural area, or only caregivers who may be assisting someone with more severe dementia at home. So it might be a restriction on the program, but most of those decisions are made by the organizations that are offering the program, as opposed to anything systemic about that program. So each organization kind of does it a little differently within the accepted evidence base, hopefully.
Great, thank you for that. And I had a question for Mike also. Mike, you mentioned briefly some of the things that some of the activities or actions that public health departments or practitioners could take. I wonder if you could elaborate or just say that list again of different things that public health can do. I know you mentioned messaging, identifying what the population looks like. I wonder if you could just kind of go through that again, just so we have a clear picture for our audience of what they can do.
Yeah, I think one of the things that's really been sticking out in some of the work we've been doing is how public health can translate information and data and research to clinical practice and clinical care. So there's sort of like a partnership between community-based organizations and public health departments that would really need to kind of develop and take place a little bit more, recognizing that caregivers aren't walking into public health departments. Public health departments typically aren't interfacing with caregivers. It's those community-based organizations who have really kind of created the support infrastructure that exists. But I think that there is a supportive role that one can play with the other. I think there's a component, like you mentioned, the messaging, the data collection, all that sort of stuff, where public health might be a little bit stronger, and then the actual day-to-day direct care interaction, developing and adopting and applying some of these best practices that Kathy and David talked about earlier.
Great, thank you. I love the fact that these programs are for professionals. So the programs on the best practice caregiving site could be adopted and used by public health departments. Kathy, you mentioned cost. So I wonder if you can share just like what the average cost of one of those programs would be.
It's really kind of all over the map, but and David, correct me if I'm wrong, about half of the programs do not have a cost to deliver. In other words, the information on the delivery components and how to deliver them and so on is free for anyone to use. And the other half have varying degrees of licensing or training fees that are, all over the map, again, depending upon the level of intensity of the program and the adherence, I think, to the fidelity to the model that's being delivered. So it requires more training, for example, than some of the other programs. And there are some that are really fully almost self-administered, that individuals can just use. I mean, a family member could use them as well if they went in, but there's a few of those. So it really has a broad spectrum. I think the cost that is hidden, of course, in all of this is the marketing cost, the cost to make the public aware that there is these programs being offered. And I would say the best partnership would be with community organizations that may already have a connection or a partnership with they're already serving families, and form a partnership with existing organizations, because the marketing of recruiting, participants for a lot of these programs is what I would call the hidden cost, but it's really an important one.
Absolutely. Thank you so much. Great answer, great information, all three of you. Again, thank you all so much. Karan, if you could advance a couple of slides, we can talk very briefly. Just want to invite all of you to sign up for our next training in August 19th at 3 p.m. And we will be talking about emergency preparedness and public health's role in helping older adults and their caregivers prepare for emergencies. So please feel free to sign up at afphs.org under events. We look forward to seeing you then. Thank you all so much. Thank you to our closed caption agency for helping us with that. Thank you, Karan, and we will all see you all next month.
Thank you.
Thank you.